Can we start now?
Start. Okay, go ahead. Go
Okay,
for it.
I think we stopped at oxytocin used in managing migraine headache. And I think we can use it for all kind of headaches. We need to understand the migraine pathophysiology in order to understand how oxytocin helps in managing migraine headaches. And I think the headaches or the migraines, it's form of a complex regional pain syndrome of the dura mater that cover the brain. And so it's you have this neurovascular disturbance of the blood vessels of the dura mater. Similar to complex regional pain syndrome, where you have this kind of sensitivity of the pains or oversensitive pain pathways at the dura mater or the meninges that cover the brain. And what happened is that the signals of the pain will be carried through trigeminal nerve. So the trigeminal nerve that we know it's supplying the face. We know the branches, right? Mandibular branch, those 5 branches, the ophthalmic branch, and the maxillary branches, right? And then we get all this feelings that goes through the trigeminal, which is the 5th nerve of the cranial nerve. But also there is nerves that is connected to trigeminal nerve or the trigeminal ganglion coming from the meninges that's covering the brain. And so they are having this common pathway, which is the trigeminal ganglion. And so what kind of the neurons or the nociceptive neurons that carry the pain signals from the meninges is calcitonin gene-related peptides and neurons. So they use these neurotransmitters to carry the pain signals from the meninges to the brain, as you see it here. Can you see it here? So it goes all the way to the nociceptive pathways, right? And it gets into the brain and gives you the feeling of the pain. But as you know, that there is ascending nociceptive pathways which carries the pain signals to the brain and give you the feeling of the pain of the headache. And but also we see that there is also a descending analgesic pathway, and those descending analgesic pathways are serotonins, neuroepinephrine neurons. It means that they are secreting those neurotransmitters, the serotonin, the norepinephrine, the enkephalins, and also oxytocins. So there's oxytocinergic neurons, part of the descending analgesic pathway, which inhibits the pain signaling and give you that stop signaling stopping the pain from going into the brain and giving that analgesic function that you need to stop the pain. And so knowing that oxytocin are part of the descending analgesic pathway that puts the brake on the pain signal of the ascending nociceptive pathway, as you see the green ones. So this gives us an idea or understanding that oxytocin can be a very powerful analgesic drug because it does inhibit the pain signaling at the level of the spinal cord, but also at the level of the trigeminal ganglion as well. And it will inhibit and interrupt those pain signals that goes through the nociceptive pathways, which are mainly the calcitonin gene-related protein neurogenic neurons, so those pain signals that's coming from the meninges, from the dura, they are carried, or the neurotransmitters, mainly they are calcitonin gene-related proteins. And so oxytocin in a certain way does interrupt and inhibit those pain signaling. And therefore, we can use oxytocin as an analgesic to interrupt the pain signal at the trigeminal ganglion here. And we can also deliver the oxytocin intranasal, I think will be a good way. And we know the intranasal delivery, it goes both ways, it goes to the blood, and it also goes through the cribriform plate. You have this ophthalmic, the olfactory neurons can carry those oxytocin all the way into the brain and past the meninges or past the blood-brain barrier, and it gets into directly into the brain targets of the oxytocin, as you see it here. Okay, giving oxytocin itself helps to enhance the production of the endogenous oxytocin. So the idea of giving oxytocin will cause the blockage or decrease of the endogenous oxytocin as a feedback. Negative, that's not the case. It's actually a positive feedback to production of endogenous oxytocin, not negative feedback. So giving oxytocin externally helps to increase the endogenous oxytocin. Dr. Mike Beamer did mention that in his lecture last time. He was talking about the pharmacodynamic and pharmacokinetics of oxytocin. And so there are already FDA studies of oxytocin intranasal as they use to manage migraine headache, but I think we can use it for all headaches because it does interrupt the pain signals at the level of spinal cord or at the level of the trigeminal ganglion, interrupting those neurotransmitters, which is the calcitonin gene-related peptides. And if you see that women do experience migraine headache during menstruation or during the menses period, because that's where the estrogen and progesterone drops. And we know when you have this drop in the estrogen, then you would have an increase in the signal of the calcitonin gene-related peptides, and it causes the trigger of the headaches. So headaches for women, when they have migraines, it happens because estrogen doesn't have
oxytocin and pain management.
Yeah,
nasal.
Oxytocin and estrogen do inhibit the pain signals that's coming through the trigeminal nerve, and the neurotransmitters that is mediating this signaling of pain is calcitonin gene-related peptide. It seems that oxytocin and estrogen do inhibit the signaling of the calcitonin gene-related peptide and interrupt the pain signals and helps to give that analgesic effect that we're looking for. So during menses, what would happen? You have the drop in estrogens, and you would have the pain and the migraine will be triggered by that. And so I think giving hormone replacement therapy, giving oxytocin do help in managing migraine by delivering and giving those two hormones. So it's not just the oxytocin, but also estrogen can also be analgesic to migraine as well. But you can just use oxytocin, and oxytocin can do that job as well. But if you have a post-menstrual women, I mean, it's good to both, give them oxytocin and estrogen if needed. We know oxytocin does stimulate the secretion of estrogen. So we don't have that much study that shows that oxytocin is enough and it can replace hormone replacement therapy. That's where I think we need to find out if that's the case. We don't have any study to prove that yet, but if we talk to the doctors here and see if intranasal oxytocin gives enough estrogen and progesterone and testosterone that the post-menstrual women needed. So something that can be done as a study, and if we can lower the dose of the hormone replacement therapy using oxytocin itself, it's considered as a success, I think. I mean, there's many studies about using oxytocin to manage autism. And we need to understand the pathophysiology of autism by now. What is autism? There's many definitions of autism or many mechanisms there, but I'll try to simplify it. Basically, autism is a form of oxidative stress of the brain. So there's too much of inflammation and too much of overactive microglia. And because of this oxidative stress and too much of free radicals, then what would happen, you would have problem with the neuroplasticity of the brain. They become more rigid, not pliable, not flexible. Normally our brain is that we form new wirings and we form new memories, and we can develop new interests, and we can enjoy things by creating those new connections of certain activities, and connected with increase of the dopamine, which gives you that joy of doing certain activities. In order to enjoy playing soccer, for example, you have to connect the activities and the wiring of the game of the soccer of the brain with the increase of dopamine. And if there is no connection there, then you will not have that interest of performing soccer or performing reading activities or attending these meetings. You must have certain increase, or must increase the brain of your brain must increase the level of dopamine and serotonin and all these happy molecules in order to enjoy sitting here in front of me and learning something, new information. At the same time, your brain needs to be pliable, needs to be flexible. The axons needs to be able to form new connections. And that's called the neuroplasticity of the brain, forming new connections related to new activities or learning new informations. So autistic patients, they don't have that normal plasticity, normal forming of wiring for new activities. So they stuck in their routine and the routine that they're doing, their certain stereotyping of activities that gives them the joy, and they start doing it repetitively because that's the only thing that increases their dopamine. And they cannot form because of the oxidative stress and inflammation, they cannot form a new circuits of neurons easily and connected to the happy molecules where they can enjoy it. And so they cannot break through the cycle and the routine and the stereotyping of activities they're already doing. And so the pathophysiology, core pathophysiology is abnormal neuroplasticity, is oxidative stress, which prevents the brain from forming new circuits for new activities and connected with circuits that will increase the dopamine, the happy molecules, which give them the joy to perform these new activities. And so understanding that the pathophysiology is oxidative stress and inflammation, oxytocin is very powerful anti-inflammatory drug of the brain. And so giving oxytocin intranasal would definitely help to increase the expression of antioxidant enzyme. It does help to decrease interleukin-6 production. So it does balance the immune system of the brain. It does decrease inflammation of the neuroglia. So that possibly helps to regain the function and normalize the neuroplasticity of the brain with the time and form new circuits for the new activities and connected to the happy molecules or the increase of the happy molecules of the brain. And I think giving intranasal oxytocin, the dosage here is it's going for international unit per kg. But we think we do, you can do intranasal up to 100 international unit, and you get almost 5% maybe of that into the brain. So I would go with up to 100. So I'll start, for example, with 25 a day, and then I go up to 100 in international unit. And this just shows you the, autistic brain, how they have an abnormal neuroplasticity and versus the typical brain with a normal neuroplasticity. And again, the neuroplasticity related to the oxidative stress and inflammation of the brain. The more inflammation, the more the rigid of the neuroplasticity of the brain, and the less they can form new circuits and enjoy new activities, and they will stuck into the stereotyping that they are, the autistic patients are doing. And is it enough just to give intranasal oxytocin to manage autism? I don't think it's just chemically it's going to be enough. We really need to have some sort of cognitive therapy, right? And that cognitive therapy, along with chemically oxytocin, together we can help to train the brain to form new circuits, to form, or the child can perform new activities and enjoy it at the same time. So you need that combination of positive social experiences, and you need to have all this cognitive therapy, behavior therapy combined with oxytocin therapy, and not just oxytocin. I mean, I'm talking about it's an oxidative stress kind of condition. So giving all this antioxidant would definitely help in managing autism, especially the polyphenols. And so a combination of multivitamins, polyphenols, antioxidants, oxytocin, all this helps to manage the oxidative stress of the brain. But you need to have the cognitive therapy, the behavior therapy, along with that for the child to develop those new activities, new neural circuits that will be connected to the happy molecules so they can enjoy those new activities.
Dr. Halasa, can you repeat the oxytocin dose?
Yeah, according to here, they're putting 0.4 international unit per kg. I think you can go up to 1 international unit per kg. Double that. But that's what the study they have. For us, we go up to 1 international unit per kg per dose or per day. That's what so if you have 100 kilogram, it gives you how much? 100 international units. So the up to, I think up to 100 international units per day, and you can split it, but you can start with 25 and then 50, and you can go up to 100, especially for adult. For the kids here, the study says 0.4 international unit per kg, but I can go with one safely for oxytocin, because you know that we're getting only 5% less than that absorbed in the brain. But according to the study, it's 0.4 international unit, but I think what we experience from all the doctors who are doing it right now, they can go to 1 international unit per kg. Okay.
Okay, thank you.
Sure. The other thing is that drug addiction, and we really need to know the pathophysiology of drug addiction. If you see the opioids in general, they give us an increase in the happy molecules, but at the same time they induce oxidative stress. So that's the bad thing about opioids. I mean, I like the portion of increasing the happy molecules. I like the portion of stimulating the mu receptors and inhibiting the nociceptive neuron signaling of the pain and dumping the pain by inhibiting those nociceptive pathways through the mu receptors, of course. But also activating the mu receptors can lead to opening up the calcium channels and causing activation of MOX enzymes and increasing the free radicals. And then the free radicals will shut down those mu receptors, will cause insensitivity of the mu receptors. So think about it. Okay, you're giving opioids, you're inhibiting the pain, you're getting that euphoria, the kick, the happiness, and the joy, and that definitely leads to what we call the addiction. But in order to be addicted, you also need to have that other components, which is decreased sensitivity to the opioids. And how is that? Opioids, yes, they interrupt the pain signal. Yes, it's energetic. Yes, it's euphoric. It helps us use that kind of euphoric, but also it is an oxidative stress molecule, and it does induce free radicals in the neuron, pathological ones. That leads to insensitivity to the mu receptors. That leads to down regulation of the mu receptors. And then if you don't have enough receptors of the opioids, the mu receptors, then you need to have more opioids, right? And then if you have more opioids, then you would have more oxidative stress. You would have decrease in the number of receptors. You would have insensitivity of the mu receptors, down regulations of the mu receptors. And what would happen here? When you have this kind of addiction, you need more and more and more and more. And then when you have this oxidative stress, it's like frying the brain, right? And what would happen? You get all this inflammation in the brain, you get abnormal neuroplasticity of the brain, and you would have this wiring of the brain that is only, and that focus and that wiring of the brain that is only for seeking more opioids. So the patient will become like zombies. Their brain is being wired to seek more opioid because that's the only way they give them that happiness, the euphoria, right? All other activities, there's no space for them because the brain is wired completely to seek more of the opioid. So they will look like zombies. And I think That's what's happening to the pain management centers. And I think there's a problem with our fellowship program, pain management, where we're giving opioid like candies. And then what will happen, we turn those patients into zombies. Those abnormal neuroplastic changes in the brain, because that rigid wiring of the brain where the activities is only consumed into seeking more drugs, and there's no space for any other activities used to be the patient, they enjoy doing. And what would happen to those pain centers that we have? They turn into zombie centers. You see those patients, they don't see anything except that drug. So when they come into your clinic, if you're trying to wean them out from the narcotics, they get upset and they got, and nervous, because that's the only thing that the brain is being wired to. And that's the only thing that gives them the joy. So they will be refusing all other treatments, physical activities, exercise. They will have no joy of anything, like, they will lose the joy of having sex or playing with their kids or working, and they will be stuck in that world of addiction, and everybody knows exactly what's happening in that world. And definitely, if they don't take those drugs, what will happen? You don't have much serotonin and all that stuff, and you have this sympathetic overactivities, anxious, sweating, all those flight reactions, nervous, and sometimes it leads to even seizures and convulsions, and patients can die because of the drug addictions. And so oxytocin is something that we may consider in managing drug addiction, not just for opioids, but all kinds of drug addicted out there, whether it's alcohol, amphetamine, name it, even cannabis. There's some addiction there, although the CBD that's pure, it has less addiction than the mixed one. And the reason, because CBD does, or it has an antioxidant, so it does not induce oxidative stress. But the CBD with THC, the one that's mixed, that may have some oxidative stress when it's being mixed, not the pure one. But anyway, they get, so oxytocin can be used to manage drug addiction because it does help to increase the happy molecules. At the same time, it does have an antioxidant effect, which will help to increase the receptor expression and increase the sensitivity of the receptors. And so you don't need that much of narcotics anymore. And with time, you can wean patients from narcotic by using it. So it does help decrease the happy molecules. So, and at the same time, does help to increase the sensitivity of the receptors. And with time, you will have the patient seeking less of the narcotics, and you can wean the patients from narcotic on that.
Dr. Halasa, we're having a little trouble understanding you.
Okay, can you hear me now?
Yeah, that's
The
better.
voice?
Yeah, there we go.
Okay, yeah. So basically, I think giving oxytocin helps increase the happy molecules. And at the same time, it gives you that antioxidant effect, which means that it will increase the sensitivity of the example of the receptor here in this case. And so the patient will seek less of narcotics. And with time, you can wean patients from narcotics. And not just that, I mean, patient who has oxytocin deficiency, genetically, they may have problem producing oxytocin in their body. They're different between one person to another in oxytocin level of their brain or oxytocin productions. But patients with or people with deficiency of oxytocin, they tend to have a high risk of becoming addicted to drugs, right? And the reason, because oxytocin does help us to give that happy molecule, does give that antioxidants, which helps to increase the sensitivity of the neuroreceptors, and that will prevent the risk of developing any sort of drug addictions. And so patients or people with deficiency of oxytocin, they do have an increased risk of being addicted. But also, the patient with oxytocin deficiency, they have problem of developing relationship, because oxytocin helps to give that bonding with others, and with your spouse and with your kids and with your dogs. And so if you see a person who is, you know, isolated, and he is not interested to be connected to people, and not interested to have a spouse or children, possibly they may have an oxytocin deficiency. We know that oxytocin gives us also the satiety. It helps us to decrease that craving of food. So that's something we need to consider as a way to manage obesity. We may consider giving oxytocin intranasal or injecting it subcutaneously around the umbilical to decrease the food craving. And again, oxytocin, it gives you that antioxidant, it gives you that happy molecule, it stimulates the parasympathetic, it inhibits the sympathetic. So definitely it helps to decrease the stress. And this just shows you the cycle of the drug addiction, and how the patients are, when they get addicted to certain drugs. Example is opioids. And opioids, as you said, that they are causing that euphoria, but at the same time, it causes oxidative stress in the brain and inflammation of the brain and sympathetic overactivities and decrease of parasympathetic, and that's kind of anxious thing. And because of decreasing the sensitivity of the neuroreceptors, then they need more and more of opioid, and they get drug addicted to it, and their brain is completely wired to seek more of narcotics, and they're being preoccupied with seeking drugs. And just thinking about that they're going to obtain the drug will help to increase their happy molecule. Just anticipating that they are going to get the drug when they go to the clinic, it does increase the serotonin, the happy molecules. And so they're completely preoccupied. The brain is completely rigid wired to seek narcotic. And then when they get it, they will start binging it. And when they binging it and take it, they get intoxicated, of course. And then they will have the withdrawal, because they don't have the drug, they have oxidative stress, they have decrease in the receptors, and so they need more. And if they don't have that more, they would end up with the withdrawal symptoms and the negative effects, right? And what will happen? You have this overactive sympathetic activities and anxious, nervous, and they may end up into having seizures if you don't give them that narcotics that they need. And also we know that during the withdrawal, they will have too much of cortisone, too much of sympathetic. And we know the sympathetic and cortisone, all that does suppress the immune system and puts the patient at risk of even having cancer. So it's very important to manage those patients. And I think opioids needs to be given in the right time, the right place, and not to be distributed or prescribed to the patient that we see in those pain management clinics. And we need to consider all this alternative approach to manage pain that does not cause oxidative stress in the brain, does not cause addiction, does not cause decrease in sensitivity of the receptors in general, especially those the receptors in this case. So because of that, we can consider using safely alternative to opioid and maybe more effective to manage pain without the side effects that we experience when we use the opioids. And we know that the pain, particularly chronic pain, remains one of the most debilitating and difficult to treat conditions in medicine. Chronic pain is difficult to treat in part because it's associated with plastic change in the peripheral central nervous system, right? This we talked about the abnormal neuroplastic change in the brain, the abnormal wiring of the brain that's only for seeking narcotics and those drugs. So current treatment for chronic pain, opioids can have adverse side effects. And we understood why, because it reduces oxidative stress of the brain. It increases the it will increase the insensitivity of the receptors, and so we need to have an adjunct anesthetics that is non-effective, that does not cause oxidative stress. I think CBD is one option, and because CBD does help the same way like opioids in increasing the happy molecules, and it does help to interrupt its energetic molecule, but it doesn't interrupt the nociceptive pain pathways. So, but CBD does not cause oxidative stress, the pure ones, not the one that's mixed with THC. So it's one option of managing pain using CBD, but also oxytocin is another way of managing, and it does not have that addictive quality most of the time. And so so oxytocin, CBD have few adverse side effects. It's effective in pain management across several chronic pain conditions. You can use it for any pain conditions, whether the pain is muscular, skeletal, or visceral. So oxytocin is a natural operating hormone that has gained attention for its potential analgesic pathway. We know it's part of that descending analgesic pathway. Okay, and so we know that oxytocin is part of the descending analgesic pathway. So we have in our part of the descending analgesic pathway. We know that the descending analgesic pathway, they are serotogenic, norepinephrinogenic, and caffeinogenic, but also there is oxytocin, which means neurons producing oxytocin that inhibit the nociceptive or pain signals at the level of the spinal cord. And so it does have an analgesic effect. And oxytocin may decrease the pain sensitivity by improving the mood, yes, because they increase the happy molecules, the dopamine and the serotonin. It reduced oxytocin, reduced anxiety. It buffered the stress, yes, because it does help to stimulate the parasympathetic and inhibit the sympathetic. And so it does help in managing the pain in general. And I think introducing oxytocin as a drug, especially intranasal, I think it's a good option or a way to manage pain, but also you can inject them into the epidural. There's many studies they can be replacing cortisone and managing pain. So I think something we may consider adding oxytocin, latest nanoparticle, along with procaine. Instead of giving steroids and lidocaine, we can load platelet nanoparticles with oxytocin as an analgesic anti-inflammatory with procaine versus lidocaine, because procaine does have an anti-inflammatory, analgesic, and regenerative effect. And we can inject them into anywhere, into the epidural, into the joints, and possibly can be a replacement for steroids, because we know that steroids has some trophic effect into the joints. But oxytocin has regenerative effect. Procaine has regenerative effect. Platelets have regenerative effect, in addition to the anti-inflammatory effect and analgesic effect. Something that we may consider in managing pain in general. Okay, so I think we already talked about that oxytocin does inhibit the nociceptive pathway at the spinal cord level, because it's part of the descending analgesic pathway. And in addition to that, we understood that we can use it also to manage migraine, because the nociceptive pathway, which is the neurons, those pain fibers that carry the same thing from the meninges, are the calcitonin generated protein, and oxytocin does inhibit those neurotransmitters release. They inhibit those and disrupt those pain signaling, and so we can use oxytocin as a powerful analgesic for many pain conditions. The other part is that we can use oxytocin to manage stroke and myocardial infarction. For myocardial infarction as an analgesic, but also as an anti-inflammatory and antioxidant. And we know that when we have stroke or myocardial infarction, what's the problem? Is that, let's say if we have ischemia in the heart, we have decreased the blood flow to the heart. What would happen here in this area of infarct of the heart is lack of oxygen definitely will decrease the Krebs cycle and the production of the NADH, right? And you would have less of reduced glutathione, right? So you don't have much of reduced glutathione and antioxidants. It will be compromised by decreasing the oxygen supply into the heart tissue, would cause decrease in reducing glutathione. Okay, and definitely you have this ischemic damage, inflammation, and necrosis, and killed it, right? Because of lack of oxygen, you don't have enough of oxygen to drive and generate the energy and to extract energy from the sugar, or from the fat, or from the nutrients. And because of that, you don't have enough of reduced glutathione, so you don't have enough of those antioxidants, and you have inflammation and a lot of free radicals as well, and damaging and death of the heart tissue. But also, when you have gain or open up those blood vessels, or you give oxygen to the patient and you open up those blood vessels by injecting streptokinase, what will happen? You will have a gush of blood and high level of oxygen. Do you think this will help the patient? No. Condition, it actually may make it even the function more worse. Why? Because too much of oxygen, what we call the reperfusion injury, oxidative stress or reperfusion injury, that happen after you open up those blood vessels and you increase the blood flow, you may cause more damage to the heart, and that function can get more bigger. And why? Because when you have too much of oxygen going in, you generate too much of free radicals, and you don't have much reduced glutathione, So those free radicals can cause more damage to the heart. And so giving oxytocin and giving McCarran Blvd and giving antioxidants possibly helps to decrease that reperfusion injury and give that kind of cardioprotective effect, but also can apply to the same to the stroke as well. And so we can say that oxytocin, because of the decreased expression of antioxidants and because of its antioxidant effect, and it helps decrease the reduced glutathione, it may help to prevent this reperfusion oxidative damage that happen when you are managing patient with myocardial infarction and you're open, giving them oxygen and you're opening up those blood vessels by injecting streptokinase and preventing that a reperfusion injury that's happening, whether it's for during the stroke management or during the myocardial infarction or in general during the managing cardiovascular events. And so oxytocin do have that kind of protection because it does decrease the expression of antioxidant, it decreases the level of reduced glutathiones, and it does help to neutralize those free radicals. And it helps to also decrease the inflammation as well. Oxytocin helps to block the interleukin-6 and all this inflammation that's happening during the episode of the stroke or the cardiac or myocardial infarction. In addition to that, oxytocin has regenerative effect. It stimulates the regeneration of the heart, so that's a good thing, right? When you have a myocardial infarction, you're going to have a stroke in the brain. It does help have this regenerative effect into the neurons and the heart. So if you want to heal the process, enhance the process of the healing of the heart and decrease the fibrosis and stimulate the stem cells of the heart, then I think oxytocin is a good thing to be given to the patient. And also it helps to decrease the cardiomyocytes, hypertrophy, and of course, which will lead to the sequela of heart failure. And decreased oxidative stress gives you that kind of mitochondrial protection. We explain why, because it will increase the expression of antioxidants and the reduced glutathione. So this will prevent this reperfusion, ischemic reperfusion oxidative damage, or we call it ischemic reperfusion injury, because of the anti-inflammatory, antioxidant effect of the oxytocin. Any question? Are we good? Hello?
Yep.
Can you hear me, guys? Everybody?
We hear you fine.
Okay, good. And so we know that oxytocin does increase the nitric oxide, and which means that it helps to increase the blood flow, right? And then we know also oxytocin does inhibit the sympathetic overactivity, stimulate the parasympathetic, and that's what we need. We have when we have angina or we have myocardial infarction, what we need to increase the blood flow, but at the same time, we need to have some anti-inflammatory effect to prevent the reperfusion, ischemic reperfusion injury, and we need to have also we need to decrease the volume overload of the over the heart. So oxytocin secretes the natriuretic peptides, the arterial natriuretic peptides, which helps the diuresis and get rid from those excess fluid, and this will decrease the overload of the heart, because that's something we need when we are managing myocardial infarction. And so all this, it just helps really in managing myocardial infarction and angina and any kind of cardiovascular event, whether it's heart or peripheral or just the brain, the stroke. Okay, so it inhibits the sympathetic activity. It also helps to stimulate the regeneration of the heart. and the healing process that's happening. So that's a good thing, right? We have myocardial functioning. You need to stimulate those stem cells and regenerate the heart to replace those infarcted tissues. But also we need to have the fibrosis. We don't want to have fibrosis. We need to have heart muscles instead of fibrotic tissue. And we need to have this anti-inflammatory, antioxidant effect of oxytocin, definitely to prevent or inhibit the ischemic reperfusion injury. And we need to have more of blood flow and vasodilation, and we need to stimulate the blood vessels and angiogenesis. And all of this is oxytocin can definitely help. So can we say when the patient has cardiac infarction, can we safely inject oxytocin subcutaneously? Possibly, yes, but we don't have that in the mainstream protocol yet. Or give them intranasal with the oxygen, right? That will be something we may consider in the future and add it in the protocol of managing angina function or stroke or peripheral vascular diseases, ischemic conditions in general. Something we need to having some clinical trials or use it in outpatients and find out if we can help those patients with cardiovascular events. Again, this just shows you how the oxytocin helps to stimulate or regenerate the heart by stimulating the stem cells. It also shows that how it decreases the nitric oxide and how it decreases the natriuretic peptide, natriuretic peptide, and how it's increasing the cyclic GMP. Why didn't that would lead to increase the blood flow, vasodilation, and inhibition of the fibrosis, and stimulating the stem cells, which all this helps in managing a cardiac infarction or angina or any ischemic heart diseases. We know that oxytocin helps to transform those fat cells, the white fat cells, into brown fat cells. We know that oxytocin helps to increase the glucose uptake. So it works like insulin, oxytocin. And we need to have some studies to show if we can decrease the dose of insulin by giving oxytocin. Why oxytocin is better than insulin? Because insulin induces oxidative stress. So that's the problem with insulin. And then when you have oxidative stress, then you'd have decreased sensitivity to the insulin with time. And that's why we start increasing the dose of insulin with time. And that's something we may help to manage that process by giving oxytocin as an adjunct. And possibly this would help to reduce the amount of insulin we needed for the patients. Some reports that I hear that it can definitely help to eliminate the need of insulin in some cases. But let's see and find out, make those studies, because it does function like insulin, decrease the glucose uptake, and it helps to increase the lipolysis, and it gives you that satiety as well. So it helps in weight loss, which you need for patients with diabetes. It has this antioxidant effect versus the insulin has oxidative effect. And that will increase the sensitivity to the insulin, right? When you have this antioxidant effect and neutralize the free radical, you increase the sensitivity to the insulin. But also oxytocin increases the secretion of insulin from the pancreas as well. So you have the increased insulin, oxytocin increases the secretion of insulin and the insulin sensitivity and the glucose uptake. So I think oxytocin will be a phenomenon to manage patients with diabetic and weight loss, and also in managing cardiovascular events as a cardioprotective or a neuroprotective molecule.
Was that a Canadian note I heard? Yes, sir, John. We both just finished our probationary period.
Okay, are you with me, guys? Yeah.
We're with you.
Yeah.
Okay.
We're
So I think because of the effect of oxytocin as an antioxidant, as an anti-inflammatory, and also it does help to manage patients with atherosclerosis. And atherosclerosis, it's basically that you have an oxidative stress, and you have too much of free radicals that will oxidize the LDL. Those oxidized LDL, they will be taken by the macrophages, and because of it's a free radical generator, so it will induce inflammation, and you would have this cycle of inflammation, which will cause more of those oxidized LDL to be taken by the macrophages and deposit those fats, and inflammation and scarring, and that leads to this plaque of fat and fibrosis and inflammation that down the blood vessels. Because of the oxytocin has antioxidant effect, and because oxytocin helps to decrease those oxidized LDL, and it helps to decrease the circulating LDL itself. Then I think oxytocin will be a good way, a good option, a good drug to manage atherosclerosis and prevent atherosclerosis as well. So giving intranasal oxytocin for all people above 40 may help to decrease the atherosclerosis effect and all the pathophysiology that leads to atherosclerosis. And it's a combination of increasing the LDL, but it's not just increase LDL. You need to also have an oxidative stress. You need to have free radicals, because what causes atherosclerosis is oxidizing LDL, not the LDL itself. So you may have high LDL, you may have high cholesterol, but you don't have atherosclerosis. Why? Because in order to have atherosclerosis, those LDL, those fat, that's circulating fat, needs to be oxidized. And so you have to have oxidative stress and high fat in order to develop what we call a form of oxidized fat, which will be a free radical generator that will be taken by the macrophages that will induce inflammation. And so inflammatory process with the metabolic process will lead to deposit of those fat plaques, inflammatory and fibrosis and narrowing of the blood vessels, which we call the atherosclerotic effect. I think antioxidant, because it lowers the LDL, it decreases the oxidative stress. So metabolically, it helps to manage atherosclerosis, and also it has anti-inflammatory effect as well. I think we can use oxytocin to manage and prevent atherosclerosis. Okay, so if you see here that oxytocin, it does help to improve the lipid profile. So it does decrease the LDL level. It does help to decrease the vascular inflammation, right? Because if you decrease the LDL and you decrease oxidative stress, you decrease oxidized LDL, so it will decrease the vascular inflammation. It does decrease the sympathetic overactivities. We know the sympathetic is inflammatory. Parasympathetic is anti-inflammatory. So if anything increases sympathetic, it will cause inflammation. Why? Because norepinephrine stimulates the Knox enzyme, generate more free radicals. So norepinephrine is a free radical generator. So if you have too much of sympathetic and you have too much of free radical, those free radicals will oxidize the LDL and will put you at risk of having atherosclerosis. So oxytocin does help to inhibit that sympathetic overactivities. Oxytocin helps to increase the basal tone, the parasympathetic, which means that it helps, as it's an anti-inflammatory. And increasing the parasympathetic also will help to decrease the blood pressure, right? Because what we call the dilation by inhibiting the sympathetic. We know that when you have this anti-inflammatory effect of the parasympathetic, because parasympathetic inhibits, right? When you inhibit the sympathetic, you decrease the norepinephrine and you decrease the inflammation. And when you decrease the inflammation, you increase the insulin sensitivity, but also you increase the insulin secretion as well. And oxytocin has positive feedback. You know, before there's a lecture that they hear about oxytocin, they have some concern that oxytocin had a negative feedback over your endogenous oxytocin. That's not the case. The beauty of this is that oxytocin does have a positive effect. The oxytocin does help to increase the sex hormones. Oxytocin does help to increase the growth hormones, and oxytocin does help to decrease the cortisol. So all of this would definitely help in managing a lot of conditions, including atherosclerosis, blood pressure, diabetes, hypertension, obesity, right? Because of the mechanism of oxytocin here. So oxytocin and metabolic homeostasis, implication of obesity and diabetes. I think oxytocin helps that in manage. We can use it to manage obesity, overweight, because it does stimulate the lipolysis. It does stimulate the transformation of white fat into brown fat. And so it helps to burn those fat, not just that, helps to burn those fat, not just lipolysis and releasing the fat, but burning it. And burning it means decrease in the LDL level, right? I mean, it helps in managing the lipid profile. And burning the fat and lipolysis will help to shrink those fat tissue. And also does help to increase the secretion of insulin. It helps increase the insulin sensitivity and the glucose uptake. So this will, all this function will definitely help in managing obesity and in managing diabetes because of all this mechanism of function. So if you see it here, that oxytocin does help in glucose uptake. That's a good thing for diabetes and also for weight loss. Decrease insulin sensitivity, decrease insulin secretion or release. It helps to stimulate lipolysis, means that it helps to shrink those fat cells. But not just that, where the fatty acid will go, it will stimulate the burning of those fat and breaking down those fat into energy in a state of sugar. So you get rid from those fat, right? And oxytocin will help to give you that satiety that you need, so it will prevent a craving of eating food, right? And all of this will help in managing weight and diabetes in general. Okay, so what will happen when those patients, they do have what we call leptin problems or insensitivity? We know that when we eat food, especially when the food contains fat, they release leptin, and then the leptin goes to the brain and it stimulates the release of oxytocin. And then oxytocin gives you that satiety that, you know, we're done. I'm not full. I'm not hungry. And so it inhibits that kind of craving of food. It gives you that satiety, that satisfaction, and it stops you from eating more. But what about those patients who are having problems with leptins? The leptins produced, yes, but it's not. There's no resistance. The receptors are not responding. Genetically, they don't respond. So they don't produce enough of oxytocin, and they start craving food and eating food and nonstop because the leptin is not working. It's not giving them that crave, right, centrally. And they get bigger and bigger and bigger, and they just eat and nonstop because of the leptin resistance. and the leptin is not stimulating oxytocin. Where oxytocin gives you that inhibition of, of the craving of food, the satiety. And so for those patients, we know that if we can bypass that leptin resistance by giving oxytocin, then we can have those patients, right? So leptin stimulates the release of oxytocin. Oxytocin gives you that satiety, right? If we say, okay, for this patient, we give them oxytocin, we can bypass that resistance, right? And we can manage those patients. And if you see it here, how that leptin resistance can lead to obesity, craving of food, because they cannot produce leptin cannot stimulate oxytocin. And I think if we give those patients oxytocin, we can manage those patients. So exogenous oxytocin obesity, large effect on fat mass and food intake, and severe obesity. We know that it does give you that kind of satiety. Improve the leptin resistance because you're bypassing it, right? Followed by decreased fat mass and food intake and leptin resistant mode, right? Because you're bypassing that. It improves, of course, we know that oxytocin will improve the glucose tolerance, protects the beta cells, improve insulin secretion, and it will improve fatty liver as well. So one of the things that we have a problem, especially with alcoholic patients, is fatty liver. So we can manage fatty liver by giving, whether intranasal or injecting them. We can start with 2 international units using an insulin syringe and inject oxytocin on the umbilical cord. The umbilicals, so the nasals, we may help to manage fatty liver. Something you may consider it. So this just shows you how that leptin is resistance here, and so those patients who are obese, they have problem with leptin is not producing oxytocin, and we can bypass this blockage by giving oxytocin, and we can manage those patients with obesity. So peripheral oxytocin treatment ameliorate obesity by reducing food intake and visceral fat mass. That's a good thing, right? That's one of the studies we start here. And that's the reason I recommend giving intranasal oxytocin, but also injecting oxytocin around the umbilical. And start with 2 international units. And you can go up to 10 international units per day. And see what will happen to the visceral fat and shrinking of the visceral fat. Why? Because it does help to transform the white fat into brown fat. It stimulates the lipolysis. It stimulates the fatty acid oxidation, the beta oxidation. So you break down the fat, you're burning the fat as a source of energy. And possibly this will help the fatty liver. You know, most of the problem we have when we grow at age is the visceral fat, which is very hard to get rid from. Even if we do the liposuction and we remove all the fat under the skin, okay, you still see the big belly, right? That's not the fat under the skin, that's the fat in the viscera, the bowel. And we need to consider manage those by injecting oxytocin. It may help to stimulate the lipolysis, the beta oxidation, and shrinking those fat. Okay, just shows you here that how oxytocin works in increasing the lipolysis, the beta oxidation, turning the brown white fat to brown fat, and also gives you that kind of satiety, right, thing that you need for the weight loss. So it's covering every aspect of weight loss, right? What do you need in weight loss? You need to reduce the fat, you need to burn the fat, you need to turn those white fat into brown fat, and you need to stop the craving of food, the satiety thing, right? You need to decrease the food intake. And I think oxytocin can accomplish that, whether giving it intranasal up to 100 international units intranasal per day, or up to 10 international units subcutaneously around the umbilical. And again, it shows you how oxytocin stimulates the beta oxidation here, lipolysis, and how it stimulates the burning of the fat, generating energy from the fat, state of sugar. And so we can obtain or reach the goal that we need, which is to decrease the body weight, increase the glucose tolerance, and increase the insulin sensitivity, right? And so we can use for both. For weight loss, we can also use for patient with diabetes, and possibly reduce the amount of those insulin and oral hypoglycemic drugs the patient needed, metformin, all those drugs, by giving intranasal oxytocin daily for those patients. And I need to see reports to patients. Now, we are learning we're translating what's in the literature and articles and publications. But we need to have more of you practicing it and then reporting what's there, what you have with your patients, because that's the real thing that we need to learn from you guys. And you know, I cannot do it by myself only. We need to do it as a team and report all the results from using oxytocin to manage diabetes and hypertension and weight loss and all those things that we discussed. And then when we have those cases that support what we're learning as a pathophysiologist and mechanism, then we have clinical cases and really have something that's substantial that will help us to reshape, redefine medicine, right? Again, about oxytocin, just again, it does help in weight loss. It also helps in fatty liver. It helps also to regenerate muscles, and helps to, if you are doing some sort of exercising, you want to build muscles, oxytocin will be something you may consider it. Injecting it in subcutaneously or intranasal may help to build the muscles as well. But in general, we see that oxytocin does help in managing obesity and diabetes by stimulating lipolysis, beta oxidation, increasing the insulin sensitivity, glucose okay, right? Hepatic glucose output, and also increase the insulin secretion and beta cell regeneration, which is a good thing if that's the case, especially for diabetic type 1. And it does help to decrease the peak of insulin of time. Okay, so see here, patient with visceral fat and how oxytocin helps in reducing, even if you see the gynecomastia, you can see some reduction there, right? And the gynecomastia thing. And also you can see the helping in the visceral fat very clearly here. So we may need to consider that in those patients and start with ourselves, because you know the lifestyle that we live leads to visceral fat and gynecomastia. I think we can start injecting oxytocin around the umbilical, starting with 20 unit, and start having this daily intranasal oxytocin. We may manage ourselves as doctors first and then patients. Oxytocin acts centrally in the brain to improve leaky gut through vagus nerve and cannabinoid signaling in the rat. So oxytocin does help to decrease the inflammation of the gut, and it does help to increase the barrier of the gut, the tight junction of the epithelium that lines the gut, preventing the leaky gut or managing the leaky gut syndrome. We know what is leaky gut syndrome. It's that you have inflammation and the tight junctions get loose between the epithelium of the gut, and then all this toxins and free radicals will be passing through the in between those epithelium that lines the gut, right? Because of the impairment of the tight junctions and become loose and leaky, and all those toxins and free radicals will pass into the blood, and then those free radical generators will aggravate any underlying inflammation in the body. So if you have leaky gut, you would have aggravated rheumatoid arthritis. You would have aggravated diabetes, hypertension. Would aggravate any neurological diseases, Parkinson, dementia get worse because of those toxins that's being leaked, those free radical generators being leaked from the gut into the blood. And oxytocin does help to stimulate the tight junction, and it helps to decrease the inflammation, especially what inflammation that leads to the leaky gut is overactive Th17. It's the Th17 polarization. It's the interleukin 6. Too much of it, it's not good. I mean, you have to have a certain amount of Th17, which is good, it's healthy for the gut and actually stimulates the healing of the gut. But if you are overactive, you have too much of interferia, then you will be damaging those gut epithelium and those tight junctions, and you cause the leakage of those toxins from the gut into the blood. And so oxytocin doesn't have interleukin 6. It stimulates the tight junction, it stimulates the healing of the gut epithelium, and decrease the leakage of those free radicals. So we may consider oxytocin also to be the parasympathetic, and it have the sympathetic. We know the sympathetic overactivity, it causes leaky gut as well, because those epinephrines or norepinephrines are free radical generators that stimulate oxytocin. And so because we know it done, the sympathetic, it stimulates the vagus nerve. It can have the inflammation, the Th17 mediated inflammation. So we may consider oxytocin to manage leaky gut. In addition to that, it does stimulate the Tregs, and Tregs suppress the inflammation, right? So it helps the polarization of the immune system into Tregs, which will help to dump the gut inflammation, dumping it down. And it helps to manage the leaky gut, but also it does help to manage real inflammatory bowel disease in general, whether it's Crohn's or ulcerative colitis. We can use oxytocin as an anti-inflammatory for those conditions as well. And because of the stimulation of Tregs, if you stimulate the Tregs, you can manage both Crohn's disease and ulcerative colitis, which is under inflammatory bowel disease. So oxytocin system alleviates intestinal inflammation by regulating the macrophage polarization. Experimental practice does help to polarize the immune system into Treg and Mreg, which will suppress those inflammation. It suppresses actually the Th17 polarization by polarizing stimulation of the immune system to Mreg and Tregs, right? And this will alleviate the colitis, whether this colitis is experimental colitis, which can be in the form of ulcerative colitis or Crohn's disease in technical word. So, can we use oxytocin in inflammatory bowel disease in general? Yes. Can we use oxytocin to manage leaky gut syndrome? Yes. Can we use oxytocin to manage irritable bowel syndrome? And yes. So because oxytocin does help to decrease all kinds of inflammation and polarization of the immune system, Th17 specifically, and stimulate the Tregs, so it will help to decrease all those inflammatory and oxidative signaling. All those oxidation and inflammation will be reduced by giving oxytocin. So if you have a patient with inflammatory bowel disease or irritable bowel syndrome, or leaky gut, being intranasal oxytocin, possibly injecting oxytocin on the umbilical, may help to manage those conditions and cases. And it just shows you all the mechanism and how it works by inhibiting those inflammatory cytokines, especially interleukin 6. This is the big one. But also it can have the oxidative signaling as well, which is NF-beta. One of the things we can use oxytocin we can use oxytocin to build muscles. So people are, if you have patients who are trying to build muscles, those bodybuilders, you can prescribe them in a course to take oxytocin nasal, possibly injecting it around the belly, so you can get over it from the visceral fat and possibly the fat under the skin as well. Recently I can see those bodybuilders, they have this big belly, they don't look nice. I think they need to get rid from those visceral fat, and oxytocin will be an answer for that. And we know all the mechanism, right? Because oxytocin does stimulate the lipolysis, the detoxidation, the burning of the fat, increasing glucose uptake, increases insulin sensitivity, all of this. And then it helps to regenerate the muscles. Think about it, it helps to really regenerate and stimulate the stem cells of the skeletal muscle and increase the anabolic effect, the anabolism of the protein anabolism. And it increases the building and protein synthesis. It stimulates the protein synthesis. So it has anabolic effect on the muscles. And it increases the volume of the muscles. And so giving intranasal oxytocin or injecting it with exercise, I think you can enhance the bodybuilding and increase the mass of the muscles, even if they are old in age. People say, well, yeah, it's old in age, it's difficult to regenerate the muscles. No, you can do oxytocin, the natural drug, versus all the anabolic steroids, which has a lot of side effects. Oxytocin is more natural, so I can easily consider that to your patient with more safety, and to yourself, and exercise and build muscle, even for the old guys. This will be the most safest way of building the muscles and reducing the fat, right? And they made some experiments to show that, they have old rats or mice, old mice and the young mice, and they take the cross section of their muscles, and then they took the old mice and feed them with oxytocin, and they took the cross section of the cross sections of their muscles. They find out the cross section of the old mouse or rat treated with oxytocin is almost similar to the young muscles from the young group of mice. And so it just shows you that the oxytocin helps to rejuvenate the muscle and make them look like young muscles. Just to see here, let's go section. It's similar to this one, right? The young ones. See how the old ones, how they look like. But if you add oxytocin, they will look like. And so if you have those old guys, they want to build muscles, they want to look great, they want to reshape their muscles, they want to increase their bone mass, they want to increase their muscles, because that's what's happening with aging. What will happen with aging? Aging will have atrophy of the bones and atrophy of the muscles, right? And so we can slow that process of atrophy just by giving and recommending intranasal oxytocin for all the patients, for all the people above 40, and possibly even injecting it subcutaneously. See this old lady, she has muscles now because of oxytocin. Okay, so what will happen when we grow in age? And we grow in age, we have all those hormones will be decreased, right? Testosterone will decrease, the growth hormones will decrease, ghrelin will decrease, the insulin sensitivity will decrease, estrogen will decrease, oxytocin, DHA will decrease, and cortisol will increase. And what will lead to all this? It will lead to decrease in the muscle mass, right? Decrease in the bone mass, right? So the decrease in the muscle mass we call sarcopenia, and this will lead to a decrease in physical performance, right? Decrease the satellite cell activation, regeneration, and definitely leads to decrease in protein synthesis, leads to decrease in regeneration, increase in inflammation. And what will happen to those when we grow in age? We increase the fat. Okay, so how we can reverse that? how we can reverse all of this just by giving oxytocin. Because oxytocin helps to increase the testosterone. Oxytocin helps to increase the growth factor. Oxytocin helps to increase the ghrelin. Oxytocin helps to increase insulin sensitivity, increase estrogen, increase the endogenous oxytocin itself, increase the DHEA, and decrease the cortisol. So we can reverse all of this and slow the process of the aging and slow the muscle atrophy and the bone atrophy and we can help to slow the process of the aging. So oxytocin is a very powerful anti-aging molecule, right? And we can help to manage sarcopenia. And it just shows you how, the sarcopenia is due to all of this. It's due to insulin resistance, oxytocin decrease, too much of cortisol, less of growth factors, right? Increasing ghrelin and increasing the sex hormones, right? And decreasing the vitamin D and increasing the BDH. But oxytocin possibly helps to reverse all of it. It helps to increase the sex hormones. It helps to increase the growth hormones. It helps to decrease the cortisol, right? And I think just by giving oxytocin, along with, I will consider definitely all the time, giving vitamin D to all the patients. And if they have problem with absorption of vitamin D, and that's what's happening to most of the cases, you're recommending vitamin D orally, but the vitamin D is not getting up. It's not high. It's not getting to the normal level that we need, even if we give them high dose of oral. And the reason because the gut epithelium is not mature enough to absorb those vitamin D that we are giving. So I think the best way of giving vitamin D is giving it in the form of cod liver oil. Why? Because cod liver oil contains vitamin D and A. A, which is carotenoids, will help to mature the gut epithelium to absorb vitamin D. So if you give them vitamin D orally, it will not be absorbed if you have deficiency of the carotenoids. And there is a big percentage of the presence of carotenoids among the populations. You may consider almost 50% of other populations are deficient in carotenoids. There is a system there, they're selling it in A4M, which where you put your hand on it and it's spectrophotometer and it's measure the carotenoid level under your skin. And if it's low, that's mean you have low vitamin A. That's mean you have immature gut epithelium. That's mean you have the malabsorption in general. You're not absorbing your nutrients. And so very important to add in your food supplements of vitamin A or carotenoids in the form of eating too much of carrots or giving supplements of vitamin A or just take out cod liver oil, which contains vitamin A and D at the same time. Okay, this just shows you the whole mechanism and the chemistry and the biochemical pathway of oxytocin, how it stimulates the stem cells, whether those stem cells are muscles or neurons, the oxytocin or the bone. Oxytocin helps stimulate all the stem cells in your body. And whether it's muscles that help to differentiate the muscle cells, helps to differentiate the neurons and also the bones. And so it does manage the patient, for reversing sarcopenia. It does help in protection of pancreatic during metabolic stress, because it does have an anti-inflammatory effect, increase insulin secretion. It does help to repair the damaged myocardium, definitely. So I can consider it during angina or during myocardial infarction. And if somebody got wounded, definitely oxytocin will be helping the process of healing process. So patient burning, wound, anything, the skin damage. It also rejuvenates the skin. It helps to slow the process of the aging of the skin. And patient, that's why when the patient is satisfied sexually, married, and have stress, and oxytocin is high, then you can see that they're glowing and the skin is tight. But when you see a patient is stressed and single and lonely, definitely you see the aging process of the skin is accelerated. And we can slow that process by giving oxytocin intranasal, or if you want to be more creative, you can also do microneedling of the platelets and you add oxytocin to it, because oxytocin does help to rejuvenate the skin, and we can increase the process of the healing of the wound, diabetic wound, especially with giving intranasal oxytocin or subcutaneous oxytocin, or even topical oxytocin is needed. And so I think there's lots of studies that shows that oxytocin does help in managing adult with sarcopenic obesity. And I think we have very clear clinical trials, and we can look at it at PubMed. And again, this is just one of them here. I'm putting it. And it just does show that there is increase in muscle mass, bone mass, and decrease in the fat, which that's what we need, right, to manage obesity. Definitely, fat itself, it's not a good thing, because when you have too much of fat in your body, fat, especially the white fat, it generates inflammation or relieve inflammatory cytokines, especially interleukin 6. So fat, white fat, does produce interleukin 6, and interleukin 6 causes sarcopenia. So in order to really build muscles, you really need to reduce the fat, because the fat stimulate or cause sarcopenia, cause inflammation, and cause catabolism, and stimulate catabolic effect over the muscles. Why? Because of interleukin 6, right? And so if you are consider treating or building muscles, you need to reduce the fat, because the fat leads to sarcopenia, leads to the production of inflammatory cytokines, especially interleukin 6, which cause atrophy of the muscles. And so oxytocin will help to transform yellow white fat to brown fat, helps to burn the fat, decrease the fat mass, and increase the bone mass, increase the muscle mass. And that's what we need, really, to start the process of the aging and rejuvenate the whole body. So oxytocin is anti-catabolic, right? Effect, so it has an anabolic effect, so it stimulates protein synthesis, and it definitely helps to regenerate the muscles, helps to regenerate the bones, increase the bone mass as well. So oxytocin has anabolic, is an anabolic bone hormone. So we can use oxytocin to manage osteoporosis. So patients who are postmenopausal, we may consider not just sex hormone, but oxytocin to manage our menopausal osteoporosis and osteopenia and sarcopenia, right? And this is just sort of the chemistry behind that oxytocin, how it stimulates osteoblast and increasing the bone mass. Again, this just shows you how oxytocin stimulates the bone mass, and it definitely helps to stimulate osteoblast differentiations, and increasing the bone mass and decrease the degradation of the bone and resorption of the bone. And this just shows you the how the oxytocin helps in increasing the bone mass in rats, and achieve the difference here in the bone mass patient for the rats, or that's being, or the mice, or the rat that's being treated with oxytocin versus the rat that's not. And you can see very clearly that oxytocin does help to increase the bone mass by taking section of the bone from those rats that's being treated with oxytocin, and the other group are not being treated with oxytocin. Again, it just shows you all the histological sections of the rats that's being treated with oxytocin versus the one that's not, and just shows you how it stimulates the bone mass. Again, with aging, what would happen with aging? and especially with postmenopausal for the women and decreasing the sex hormone and estrogen level, you get all these problems, right? You get sleep disorder, the anxiety, the metabolic syndrome, the cardiovascular disease. All this will increase with aging and postmenopausal for the women because of decrease in the sex hormones and the oxytocin. And how we can reverse all these problems of the postmenopausal symptoms and pathology is by giving oxytocin and possibly sex hormone. Is the oxytocin will be enough? Can replace sex hormone? We don't have a study for that, but we can at least say we can reduce the amount of the sex hormone needed if we use oxytocin. So we don't need that high dose of hormone replacement. I think it's good to have oxytocin through the sex hormones to even minimize any side effects of the sex hormone if there's any. So oxytocin helps to enhance the efficacy of the sex hormone because it stimulates the endogenous sex hormone. So that's the reason why. So oxytocin alleviates oxidative renal injury and pyelonephritic rats via neutrophilic dependent mechanism. We know that oxytocin helps to decrease the polarization of the immune system TH17 and the neutrophilia and decrease interleukin-6. Knowing that we can use it to manage almost any inflammatory disease in our body, including pyelonephritic disease. So if you see here the oxytocin, it has multiple effects, which are all of them are great and good, right? It does help to increase the cholinergic outflow, it decreases sympathetic, it releases nitric oxide, right? It stimulates the stem cells, whether it's in the bone or muscles or in the skin. It balances the immune system, right? That's a good thing, right? It decreases the TH17 polarization and interleukin-6, which is a good thing. It just helps to enhance the immune system and balance the immune system. So you can use it for managing autoimmune diseases. And also, you possibly can use it for patients with cancer, especially if they have too much polarization into TH17, which pulls the immune system away from TH1. So I may consider oxytocin for that to inhibit polarization to TH17. And you know, it just helps to balance the immune system in general. And we saw that in managing colitis, we can use it to decrease the inflammation of the gut and definitely manage irritable bowel syndrome, inflammatory bowel syndrome, and leaky gut syndrome as well. So it has it has multiple effects in our body, and I can consider oxytocin as, you know, when we have a crash in the computer, what we do, we reset the whole computer, right? We press the reset button. I think oxytocin is the homeostatic reset button for our body. So give them oxytocin, will reset the whole physiology of your body back to normal. Oxytocin alleviates cellular senescence. So oxytocin receptor-mediated extracellular signal regulated kinase. And so oxytocin does help to get rid from the senescent cells and get rid from all those inflammatory cytokines that's being secreted by the senescent cells. And it's still the process of the aging. So it can have the senescent cells from secreting senescence-associated secretory phenotype, which is interleukin-6, basically. And it helps the process of the aging, and possibly it can have the senescent themselves. It may induce the autophagy of senescent cells and inflammasomes and cancer cells. So it does help to rejuvenate the body. It helps rejuvenate the skin, the muscle, the bones. Every piece of the body can be rejuvenated by oxytocin, by getting rid from the secretion of the senescent cells and getting rid from the senescent cells themselves by inducing the autophagy. And so this is the whole senescence that leads to aging of the cells, and this is all the manifestation of the senescence cells. What they do, they cause secretion of all those inflammatory cytokines, especially interleukin 6, which can lead to all these problems. It can lead to mitochondrial dysfunction. It can lead to stem cell explosions. It can lead to epigenetic problems. So if oxytocin induce autophagy of senescent cells and inhibit the senescent cells secretion, then we can reverse all these problems, all these manifestations and effect of the senescent cells in our body, right? And I just shows you how the senescent cells is causing disruption of your normal cells, and how it's just speeding the process of the aging and atrophy and the inflammation. And what we need both. We need to inhibit the senescent cell secretion, and we need to induce autophagy of senescent, and I think oxytocin will help that. It will help to stimulate the autophagy of senescent cells and inhibit the senescence secretions of those cytokines that leads to all this aging and inflammation, and can lead to cancer as well, oxidative damage and all that. So those zombie cells we need to get rid from them, and I think oxytocin will be the answer. What are the things that helps to get rid from the senescent cells and inflammatory and cancer cells is fasting, especially the time-restricted fasting that we talked about, the time-restricted dieting that Dr. Joseph James in our meetings is talking about. Because, you know, with fasting, you can inhibit the mTOR, and you can induce autophagy. Along with oxytocin, I think we can definitely help to get rid from all this pathological effect of senescent cells. The other thing, if you have dry mouth or even dry eyes, you can go ahead and give oxytocin intranasal. It does help to manage dry eye and also the dry mouth as well, and stimulate. But also we can use oxytocin to stimulate 6 hormones as well. And so we find out if you give intranasal oxytocin that the salivary 6 hormones will increase as well. So yes, oxytocin helps stimulate the secretion of the salivary glands. It helps the secretion of all the mucous glands in your body, nasal secretion. So and the quality of the secretion as well, you know, salivary or nasal. And I'm talking about increasing the anti-inflammatory or antibiotics of the salivary, or the mucus secretion, or the salivary secretion of the nasal and the oral, and also increase the immunoglobulin A as well. And that's the reason we can use intranasal oxytocin during this flu season that we have, because if we give intranasal oxytocin and we increase the mucus secretion, we increase the immunoglobulin A, we increase the lactoferrin, we can definitely help to get rid from all those flu viruses and those bacteria and preventing them from invading our body. So something you may consider during this flu season, which it's getting pandemic, is giving intranasal oxytocin. Now, again, oxytocin does help to stimulate 6 hormones. And if you give intranasal oxytocin and you test the salivary testosterone before and after, you can see an increase in the salivary testosterone, which is something good, right? Because that's what we need when we grow in age. We need something that stimulates our sex hormone, whether you're female or male. Okay, so as you said, the oxytocin is the reset, the homeostatic reset molecule that will reset your physiological process back to normal, and it has multiple functions. And think about oxytocin helps to stimulate sex hormone. It stimulates the insulin, which will help to manage patient with diabetes weight loss, managing patient with obesity. It inhibits the interleukin 6, the polarization of the immune system TH17, which I can use it for managing autoimmune diseases, and I can use it for managing cancer, allergy, inflammation. It's balancing the immune system. It has this natriuresis, which means that it has this diuresis effect. So I can use it for managing heart failure, right? It definitely helped to increase the lipolysis. It helps the peak oxidation, so I can use it for weight loss. It has a vasodilation effect, so I can use it for managing hypertension. It helps increase the gut motility, so I can use it to manage constipation. It helps to manage decrease the bone mass, right? To stimulate osteoblast and the bone mass. So I can use it to manage osteoporosis. I can use it to manage heart failure. It slows down the heart rate, right? That's what you need when you have myocardial function or angina. You want to slow the heart rate. And also you want to get rid from those excess of fluid. It stimulates the breathing, which is good for sleep apnea. And give it to baby, can start giving oxytocin to manage sleep apnea and help them to breathe and give you that deep breathing and oxygenation that the patient needs. It helps definitely. We know already oxytocin helps in delivery, contraction of the uterus. This is something that's the well-known mechanism of action, and we use it to induce delivery with oxytocin. We know that oxytocin helps in nursing the baby because it stimulates the contraction of the muscles of the breast. And because of the oxytocin helps to stimulate the secretion of the mammary gland, it also oxytocin we can consider it as a way to prevent breast cancer. Why? Because when you contract and you secrete all the mucus, all the bad epithelium and senescent epithelium that goes along with the milk, right? All those precancer cells, all that can be squeezed out by the oxytocin. So you can get rid from any inflammasome or senescent cells or precancer cells by stimulating the mammary gland and contraction and getting rid from all those nerve tissue along with the milk. So that's the reason, a woman, but none of hers means that she's not pregnant at all. They tend to have more cancer, breast cancer, than the pregnant multiparous, the women with multiple pregnancy, because they have those multi-pregnant women, or multi-pregnancy women, they have a lot of, they have high level of oxytocin, so they have that points of oxytocin and contraction and getting rid from all those precancer cells, but also oxytocin helps to balance the immune system as well and helps to stimulate the cytotoxic T cells to get rid from any cancer cells in the breast. So can I consider oxytocin as a drug of a choice to prevent breast cancer? Yes. I think I will definitely consider it as a breast cancer prevention, and there's articles and publications to support that. And yeah, oxytocin helps to bonding and pairing with your spouse, with your dog, helps that kind of mother-baby relationship, right? Stimulate or enhance the monogamy relationship, by the way. It does help the social recognition, social behavior, social memory. It's induced sleep, it has analgesic effect. So I think it has everything that we're looking for, right? It stimulates the growth hormones. It also decreases by the way, the TSH, and so it does help to dump too much of thyroxines and too much of sympathetic activity, and enhance the parasympathetic activity, and also it dumps the cortisols, right? So there is some clinical studies about male anorgasmia, treated with oxytocin. So if you have a problem with an orgasmia, give them oxytocin. It may help that libido, that orgasm. It helps to increase the testosterone production, the dopamine. It helps that euphoric effect and the bonding and erection and all the process that leads to the mating and having sex. And so if you see that all those molecules that leads to the bonding between and enhancing the sex activities, it's not just testosterone, of course. It is included testosterone and estrogen and dopamine and serotonin. But if you see that oxytocin mainly, it works on the attachment and it helps in the erection process and getting into the orgasm effect. But if you see oxytocin stimulates all of other things. It stimulates estrogen, testosterone, so it does have part of lasting and attraction because it does help to stimulate the happy molecule, and then that attachment and that erection and the orgasm and all the process of bonding and sex and pleasure and all of that good stuff. Okay. And so, as you see, the oxytocin really involved in all the process of sex, whether the arousal, the erotic inputs, the fantasy, the increase in libido, erectile tissue, empathy, love feelings. All of this is mediated by oxytocin, right? And so, and all the process of the orgasm, and we can see that oxytocin is involved in all the process of sexual activities, the physiology of the sexual activities. Again, oxytocin affect and inhibition of NF-κ-beta pathway in mice breast cancer. So, can we say oxytocin can be given to patients as an adjuvant to treat breast cancer? Yes. And one of it is inhibit the oxidative stress and the free radical that leads to the inflammation, which can lead to also stimulating cancer process. And also it inhibits the interleukin-6, so that means it inhibits the polarization of the immune system away from Th1. And that means it has the immune system by inhibiting the Th17 polarization. Combining with all these effects, including it stimulates the contraction of the mammary glands and getting rid from all this inflammations and precancer cells and all those bad tissue along with the milk, and getting all this bad tissue away from the body. I think oxytocin can be safely used as preventing and treating breast cancer. So it also optimizes the tumor microenvironment because it doesn't have the polarization of the immune system into Th17, which is away from Th1. So something that enhance definitely the tumor microenvironment. It inhibits the fibrosis and the isolation of those cancer cells from the immune cells. So I think oxytocin is something helps in improving the tumor microenvironment and enhance the anti-cancer effect of the immune system. Again, as you know, when we have the COVID-19, what happened is we end up with this isolation, and the isolation led to all this stress and sympathetic activities and increased in cortisols. And what would happen when you have the isolation and you have too much of cortisol, too much of stress, too much of norepinephrine? The cortisol will suppress the immune system, we know why, right? And then that the cortisol polarizes the immune system, it suppresses all the inflammation, but it's more suppressing the TH1 versus the TH17. So it seems like it pushed the immune system into TH17 away from TH1, and that will break the cage from the immune surveillance cage over the cancer cells, although the cancer cells will start popping out, right? And that's the reason why during after the post-COVID, we see the cancer cases are increasing because of the isolation, stress, and the cortisol, and the suppression of the immune system, especially the suppression of the TH1 immune polarization. And also the epinephrine, it's a free radical generator. It decreases the inflammation, which will lead to definitely all this, those free radical damage and the DNAs and the mutations that leads to cancer. So we can say that the policy that's being used in COVID, which is the isolation, it's actually it led to more increase in the cancer rate and increase in the death rate. So we can blame some of the aggressive tight isolation that happened during COVID. We can blame that, and we can relate that to the increase in the cancer. So oxytocin, in certain studies that shows it has anti-cancer effects, certain cancers it stimulates cancer. So we need to be very careful when we use oxytocin in cancer patients, making sure that we combine oxytocin with other anti-cancer drugs, and not using it by itself, so we can get this combination anti-cancer effect, and maybe cancel any carcinogenic effect of oxytocin if you combine with other anti-cancer approach and methodologies and pathways and ways that we're doing. Because when you manage cancer, it's not enough to just do chemotherapy. You need to do all this combination of chemo, immune, nanotherapy, metabolic, and possibly adding oxytocin. If you add it all together, then possibly you can have better. And then they can cancel any carcinogenic effect of any of those drugs if you have a combined, well understood cocktail of anti-cancer regimen. Okay. So yes, oxytocin, we said that it helps to increase the mucus secretion. It also gives, this lacrimal gland secretion as well. So we can use oxytocin safely to manage dry eyes, right? That's what's happening mostly for old ages. They have dry eyes. Just give them intranasal oxytocin, and then you can inhibit all this inflammatory process, especially interleukin-6. Definitely you stimulate the GABA, so you decrease the pain that's coming out from the dry eye, and you increase the secretion. The quantity of secretion will increase as well. The immunoglobulin A will increase, electroferrin will increase, and it has a sensation as well. So I think oxytocin will be a good way to increase the TIF
Part one and a part.
and decrease the inflammation. Yes, Dr. William. Is it too much?
Yeah, a little bit. I think we need to have you come back for another part.
Okay. Sure.
After we're kind of overloaded here, I think.
Yeah, I know. Okay, that's fine. We can do a part 3 when we have time. And but if you have any questions,
anybody out there have any questions? There's in the chat. There's a link to a video from Shel Stein. According to Vedic philosophy, a substance called soma is considered the nectar of immortality. Could soma be oxytocin?
could stoma be oxytocin?
Yeah.
There's lots of drugs like stimulate oxytocin. I think what the mushroom, right, and does increase the oxytocin production.
What
So
are you What are you using are you doing any type of lab studies for oxytocin?
Well, currently we're just having doctors are using intranasal oxytocin and we're getting their reports, and most of them are positive. So that's what we're doing, basically compounding pharmacy is collecting data.
Okay,
From
because I remember a long time ago, Dr. Hertog had a lab in North Carolina that was doing some sort of urine, 24-hour urine test. But I don't.
Yes, that would be nice for just measuring oxytocin, the urine, 24-hour urine test. And then if the patient is deficient, then you may consider also giving those oxytocin, or you want to monitor the efficacy or if your treatment, finding out if you're really delivering oxytocin to the body enough, then you can do before and after, something like that.
Okay. Maybe we could do a little write-up here, a sort of a summary. Oxytocin's good for fill in the blank. And
well, I think it just if you see here, it's just everything. If you go to, okay, here we go. Oops. What happened to my slide? Can you hear me, guys?
yeah, we hear you fine.
Okay, well, in general, we will see that oxytocin helps in resetting the homeostasis of your body in general, and every aspect. It had anti-inflammatory, antioxidant, anti-cancer. It inhibits senescent cells. It stimulates all the hormones that we needed. That gets that's produced during with aging. So I think it's just something we can recommend it for anybody above 40 years old to slow the process of the aging and manage all the clinical conditions out there, whether it's inflammatory or degenerative disease or pain or cancer or infectious or so it's just one of the molecules that can be used to manage and prevent chronic disease across all medical specialties. That's what I see about oxytocin. And I'd like to hear the feedbacks from the docs here and let us know what they experience and how they feel, and figure out all the mechanism of action and try to prove all this with clinical studies and our cases. That's the summary of this is just you using it and give us your experience and your feedback and your outcome and how we can improve the regimen of treating all those chronic diseases and how we add on and how we redefine it with adding all those things that we are learning from those meetings.
Okay. Okay. Anybody else have any questions, comments?
Yeah, why don't we go ahead and start putting together a research committee, those in our little group that are very interested and knowledgeable of research, because we do have several projects going on, including out of the United States, where we can do some simple research to get some simple, honest answers. And so those who are interested in research, I think we should form a little committee.
I think working with Dr. Mike Beamer, as he is giving out all those compounding oxytocin intranasal, possible injectable, he can be the hub and the data source, and then he can supply the research as doctors, and then we can do some meta-analysis of all those of the results of those clinical cases and report them, whether it's positive or negative, and report the dosage and the outcome and before and after. And but we need to determine exactly what pathology that you're looking for. Let's say dry eye, let's say tinnitus, let's say we want to treat heart failure, we want to treat weight loss, we want to treat diabetes, hypertension. We will come up with, we want to treat neurological disease, Alzheimer's, Parkinson, and see if intranasal oxytocin does help with these conditions and improve their quality of life. So it really depends on the doctors and their interest and their patients pool and what they're looking for. And then they come up with a proposal. Say, I have interest of solving this problem. I have a lot of cases of this condition. And I'm using oxytocin, and here's the data, and here's the results. And we can definitely define all those, all the process and all the diseases that we want to target, but definitely need some sort of structural collaboration and a team to determine the protocols and to determine the clinical study, the methodology, and the dosage. And we need to standardize all of this so that we can come up with the right outcome.
First of all, for us to make anything stick, we're going to have to do research that is logical and logical above board and with the knowledge of our members who do it. So it's not just oxytocin. We have 1,000 other things we can look at, but I want to start with a team that can do this kind of research. We've done it before, and there are those people who are smart and can do it, and there are simple things we're doing. We're doing research in Honduras right now, and every penny of that research is coming from my pocket, but we've also had others put hundreds of thousands of dollars into it. The word oxytocin isn't mentioned, and other things that should be mentioned aren't. But there are several methods of treatment we're doing with education that requires research, but it will be the simplest medicine in the entire world. We want to prove that works as well. But with our crew, we need to get a committee going who enjoys research, not who enjoys oxytocin, not who enjoys hormones, who enjoys research. It's a mathematical game for some people, and we need those people. I'm not one of those people, but we need that.
Sure.
I'm done.
Okay. Thank you, John.
Yeah.
Okay. Okay, everybody. I'm at the end of my rope here. So
It's 5:14 a.m. here.
I was going to say, I don't know how you did this for 2 hours, Dr. Halasa. You're Iron Man.
I'm learning from you. Your lectures are too long, comprehensive, informative, and we just I like what you're doing.
I'm learning to
trying
shorten them. I'm learning to shorten them. So, okay. I think we have Dr. Joseph next week from your group also. When that
Oh,
RAS
good.
is-
Okay.
So, yeah.
Yeah.
Okay. So, everybody, I hope you had a good holiday week wherever you are, including Libya. A new year coming up, and hopefully we'll have some new adventures and new a renewed spirit. Thank you all for being with us, throughout the whole time. And Dr. Halasa, can't thank you enough for tonight's presentation. I'm just going to say good night. Anybody have anything to add, questions, comments? Otherwise, it's getting quite late, and we got to let Dr. Halasa get some sleep.
All right. Good night, everybody. Yes.
Good night. Thank you so much.
All right. Take care. Okay. Bye.
Okay, John, anything from you? Anything else?
All's good.
Okay. All right. Say hello to Sylvia for me.
All right.
Everybody else, Ron and Marie and Claudia, Anna, please have a fine week and a fine new year. We'll see you next week. Same time, same station.
Blessings.